Thank you very much, dear organizers, participants. Thank you for invitation to share my story. And I'm very sorry I couldn't attend in person. A few days ago, I received a notification on my phone saying I have been in contact with COVID positive person within the past 2 weeks. What a fantastic innovation, right? But I spent several hours worrying when and with whom I have interacted enough from my home office to receive this notification, and if I'm at risk or made someone at risk, until State Disease Control Center called me and said that this happened several times on Sunday. What exactly hour, they couldn't tell me. And they also said the distance was 5 meters, probably someone behind the wall. If I recall correctly, I had allowed collecting such data no further than 2 meters from my device. In my opinion, this shows clearly a flaw in developing the app. Although fantastic innovation, they probably forgot to involve end users, society, and patients to get it right from the first place and save resources, both employee time and my nerves. Why I always insist that patient engagement is key for success nowadays in whatever decisions are made. Let me explain. I was born with a rare disease, von Willebrand disease. Basically, my blood lacks one molecule, and or maybe it's defective, so my blood doesn't clot properly. I have all the symptoms throughout my life, but I have adapted and still smiling. It is now more than 30 years since my country is not able to diagnose it precisely. And precise diagnosis means proper treatment, which I can't access when I need it. Probably I would be a convenient patient if I could not read English and did not connect to other patients internationally and nationally. To know what is the progress in the world, in my diagnosis and treatment, in my situation. But I'm not convenient. I know very well what I need, and I demand it on all levels. More than 10 years ago, I started my crusade to fix this situation. And often I'm seen as too demanding, criticizing, and sometimes other stakeholders in the field even can't grasp what I'm talking about. Back in the business school, I was taught that innovation can happen in two ways. One is innovation in products, the other one in processes. Back in my professional life, I also went through extensive Lean Six Sigma training and learned that processes must be easy as possible. Is that true in the field of healthcare? I'm afraid not. And oftentimes, I just can't understand why it is so difficult to implement small but essential changes in the system. In my case, like Harry's already told in the morning, I always carry a pile of papers and explain doctors why I can't receive exactly the same treatment as others because of my blood. There is nothing in the e-health system to indicate my rare disease instantly, so I constantly face surprise in doctors' eyes and belittling or denying my situation because of lack of knowledge or understanding. And it is okay. No single doctor can know all nuances of more than 6,000 rare diseases. The problem is that it restricts me from access to proper treatment, even in emergencies. This is also the case for another 90,000 people with rare diseases in Latvia. For almost 10 years, system is not able to implement ORFA codes to their patient information systems, and therefore we miss a chance to analyze data and help these people receive better care. Rare diseases teams in all three clinical university hospitals have done tremendous job manually checking records of more than 15,000 patients to register them with a rare disease. Is this a proper registry? Well, if you call a list of names with few personal data together with condition, a proper database, in my opinion, it's not. And we are far behind other countries in this regard. We can't run proper research, participate in innovation, and provide the care patients need, personalized care. How patients can contribute? I must say, too many still think that patients are sick bodies in the bed, and only doctors and managers can come up with solutions we need. Look at the talks today. This is the time we have to admit that we can go only in cooperation. And cooperation is not just politely inviting patients to give sad speeches at events for free or using us for distribution of information. Cooperation means that we sit by the table and make decisions and solutions together. You have the skills to develop digital tools. I have skills and possibilities to engage real patients in their language. As patient expert, I have all people with bleeding disorders in Latvia behind me. And we know the right endpoints that we want to be included in the tools and strategies. I closely work with 14 rare disease groups in Latvia. We have extensive experience with how our diseases are treated locally and internationally. And I have created a network of 30 patient organizations in Latvia: cancer, infectious and rare diseases, diabetes, heart problems, and others, to provide common views on aspects that relate to all of us, which is improvement in access to healthcare in whatever you can imagine, qualitative services, effective medicines, rehabilitation, clinical trials, and even information. Why patient organizations, not all organizations in health sector? Because unlike others, we are patients ourselves. We are there for our children and our parents, and we know the real situation and can easily identify what and where should be fixed. Unlike you, we work mostly for free in our free time because we care. Yes, in Latvia we are only few people, but we work closely with our peers in other countries. For example, I'm also a board member in nearly 60 years old, $20 million nonprofit organization with members from 147 countries in the world, World Federation of Hemophilia, which has organized donations of 1 billion units of factor concentrates to those countries that are too weak to provide care for their patients. We help countries set up proper care to achieve treatment for all mission. We have created global registry of people with bleeding disorders and invite countries to participate. We understand in some countries there will never be enough resources to create reliable registries for a handful of people. There are approximately 300 people with bleeding disorders in Latvia, but Latvia has not joined this registry yet. We at WorldFed are also now working on gene therapies registry because the science and cooperation has taken us closer to the cure than ever before. We in Latvia are not even able to start talking about how to cover costs of such innovative therapies, not even that we must cooperate with centers of excellence in other countries. To provide best treatment for people with rare diseases, Europe has created European reference networks, which provide state-of-art treatment and expertise for patients and from doctor and doctor consultations and research. Are we using it to full extent in Latvia? I am afraid not, because of lack of time and understanding and administrative barriers. As patient advocacy, this field mostly relies on enthusiasm from some doctors. Europe talks about United Rare Disease Policy. United Nations is about to adopt resolution on persons living with rare disease and their families. We all strive to achieve sustainable development goals. I do not have to talk about benefits of collecting and using data. But despite all this progress in the world and my dedication to fix the situation in my country and beyond, I must admit, my dad still has nosebleeds every day and no access to proper treatment. I am not able to access proper treatment neither. That is true for too many patients, and we are tired of being unheard. The interests of other stakeholders are still more heard than the real needs of real patients. I cannot change it alone. Unless we start really putting patient in the center and engaging us meaningfully in whatever you do, there will be no innovation that truly benefits the patient. Thank you.